Hi, this is Dr. Pulkit Agarwal, ENT and head and neck surgeon from Om Shaanti Hospital, Kalibari, Bareilly. Come on, let us know about
What is vertigo? Vertigo is a sense of rotation, rocking, or the world spinning, experienced even when someone is perfectly still. What is the physiology of balance? The human balance system works with our visual and skeletal systems to maintain orientation or balance. Visual signals are sent to the human brain about the body's position in relation to its surroundings. These signals are processed by the brain and compared to information from the vestibular, visual, and skeletal systems. Our brain receives inputs from our eyes, muscles, joints, and vestibular system in our ears. Then it processes these nerve impulses so that it can give the person a correct perception of the environment. Our ears contain special parts like the saccule, utricle, and 3 semicircular canals, which are all part of the vestibular apparatus. The purpose of vestibular apparatus is to provide the brain the correct perception of equilibrium, balance, spatial orientation, and motion. The parts that are responsible for vertical orientation are the saccule and utricle. The rotational movement is detected by the semicircular canals that contain fluid, known as endolymph. The endolymph moves and triggers the sensory receptors within the canal, which sends nerve impulses to the brain regarding the movement. Impulses from both canals of the side of the head would normally send symmetrical impulses in order for the brain to interpret the impulses properly. Types of vertigo. There are 2 possible causes of vertigo: peripheral vertigo and central vertigo. Peripheral vertigo. Peripheral vertigo refers to the disorders that involve disturbances in the inner ear. The common disorders that may affect the inner ear, thereby causing the person to experience dizziness or vertigo, include vestibular neuritis, inflammation of the vestibular nerve, which is responsible for taking the nerve impulses from the semicircular canals in the inner to the brain, labyrinthitis, inflammation of the labyrinth, which is also in the inner ear and most of the time may also involve the vestibular nerve. Both of these disorders are usually caused by a viral infection that may have reached the inner ear. Other causes include Meniere's disease. This occurs due to increased fluid in inner ear. Benign paroxysmal positional vertigo, or BPPV. This results from the movement of the otolith, which is a very small particle made of calcium inside the ear. The otolith organs detect the movement of your head and its relation to gravity. For some reason, the otolith can be dislodged and moved into the semicircular canals and affect the movement of the fluid inside, thereby causing it to send irregular nerve impulses to the brain, making the person get dizzy. How to treat BPPV? The most common and effective treatment for BPPV is known as the canalith repositioning procedure. The procedure consists of several simple and slow maneuvers for positioning your head. The aim is to move the particles from the semicircular canal to the utricle, where they don't pose a problem. Each position is held for around 30 seconds, after which any symptoms or abnormal eye movements stop. This procedure is more widely known as Epley's maneuver. Central vertigo. Central vertigo refers to the dizziness of vertigo that result from a problem in the brain. The area of the brain that is usually affected is the brainstem or cerebellum. How to diagnose vertigo? Vertigo can be diagnosed based on 1. Clinical history and symptoms being told by patient. 2. Blood test to check for presence of infection. 3. Romberg test. The doctor will have you stand with your eyes open and feet together, then maintain your balance while your eyes are closed. 4. Vestibular testing to check for any involuntary movements of the eyes. Nystagmus. 5. Fukuda-Unterberger test. In this test, the patient will have to close the eyes and march in place while trying not to lean to the side. In some instances, the doctor will require you to undergo diagnostic imaging tests like CT scan or MRI to rule out central causes of vertigo or any tumor presence. What is the medical treatment? Treatment of vertigo depends on the causative factor. Peripheral vertigo can be treated by bed rest, avoiding sudden position changes, and use of vestibular blocking agents or VBAs. These medications help relieve the inflammation in the inner ear, relaxes the muscles, and prevent other symptoms associated with vertigo like nausea and vomiting. What is the surgical treatment? Surgery can also be another treatment option, especially for persons with Meniere's disease who are suffering from intense and frequent vertigo attacks. Endolymphatic sac procedures. This involves the decompression of the endolymphatic sacs by removing a tiny part of the bone to allow better fluid absorption or decrease fluid production. A shunt may also be put in place to facilitate fluid drainage from the inner ear. Labyrinthectomy. The removal of both the hearing and balance organs of the ear. This is only done when the patient's affected ear already has total hearing loss. Vestibular nerve section. This procedure is done by cutting the vestibular nerve, which is the movement and balance sensors in the inner ear. This can help relieve vertigo attacks and at the same time prevent hearing loss. Prognosis. Most of the symptoms associated with peripheral types of vertigo usually resolve on its own within a short period of time. Otherwise, you need to see a doctor to make a treatment plan.
अपने डॉक्टर से मिलने के लिए और अधिक जानकारी के लिए आप संपर्क कर सकते हैं 7500-692-860 पर। धन्यवाद।